In this video, I'm going to talk about what to expect in your first 6 weeks after having ACL surgery. The first 6 weeks after surgery can be quite daunting, and it's often quite unclear what to expect in this time. However, we know if we do the right things at the right time in the right way, our outcomes in the long term can be so much better. Whilst watching this video, it's important to remember that every type of ACL surgery is different. It will differ depending on the surgeon, coexisting injuries, and the type of graft used. So follow this video for guidance and a general framework. However, it's really important to follow your surgeon's specific advice when following your rehab protocol. The first factor we want to look at and pay attention to is pain and swelling. It's completely normal to expect a high amount of pain and high amount of swelling in the early days after surgery. However, we want to keep pain and swelling under good control, or as best as we can. Use around 4 out of 10 pain as about the ceiling for a manageable amount, and do our best to keep swelling under maximum control. Any increases in pain and swelling can be signs that we're overloading or overusing the knee too early. And persistent pain and swelling can lead to poorer outcomes in the long term. So really important we get this early stage right. Another point to remember is that ongoing and prolonged pain and swelling can lead to muscle inhibition, particularly of the quadriceps muscle here. That, should it persist long term, it can cause deficits in knee extension strength and prolong the recovery phase. The next factor we look at after surgery is your range of motion. Again, another crucial step in ensuring better longer term outcomes. As a primary goal, we want your knee to be straight as soon as possible. That means 0 degrees of extension. 0 degrees of extension means a nice, straight, healthy knee. If we don't get that as early as possible, it can cause persistent stiffness of the knee and, again, prolonged stiffness in the later stages of the recovery. The research shows that the sooner we can get the knee straight at 0 degrees, the better your longer term program is likely to be. In terms of flexion, as soon as possible, again, this will vary with the type of surgery you've had, but if we can get 90 degrees as soon as possible, ideally within the first 6 weeks or so, that is again associated with better outcomes in the long term. Quadriceps activation. This muscle here, the quadriceps, is one of the key muscles that helps to stabilize your knee. The quicker we can get it firing and get it activated, the better. Doing simple exercises like a static quad, where you squeeze the thigh as much as possible and lifting the heel up, the sooner we can achieve that, the better. Once you're able to do that, another exercise to progress onto is a straight leg raise. So once you've got the static quad, then being able to keep your knee fully straight whilst lifting the leg up and down continuously without any lagging of the leg, again, is another goal to look for. The fourth thing we look at is being able to normalize your gait pattern and movement patterns as early as possible. So one common trap not to fall into in this 6-week window is rushing off your crutches too quickly or too early. When people do this whilst they still have a limp or their movement patterns aren't quite ready to rush off the crutches, it can cause overloading of the knee joint and then persistent swelling and increase in pain levels. The final point to consider is it's really important as best as possible to preserve your physical fitness and overall general health in that 6-week window as well. Because activity levels tend to be a lot lower and less than pre-op, it can come with reduced cardiovascular fitness, deconditioning, and generally losing our conditioning. One way we can help to prevent that or minimize the effects of that is maintaining some kind of aerobic fitness or muscle training in the unaffected areas. So training things like your upper body, your core, and upper body aerobic exercises are still beneficial in this window. Recovery from ACL surgery is a long process, and it's a marathon rather than a sprint. We're here for you to answer all your questions and make sure you're meeting the milestones at the right stages, at the right time, and we're here for you if you have any concerns during the process.